The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Sierra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. C-sections. Let's talk about them and whether or not a doula is helpful in a C-section. Spoiler alert, we're helpful. So as a doula, I have supported many cesarean births, and I can tell you confidently, support does not become less important because of a surgery. A doula's role doesn't disappear, it just shifts. It's things like emotional support, advocacy that's non-medical, helping you get the things that you want even though you're in a C-section doesn't mean that all of your birth preferences go out the window, and also continuity of care. So, of course, there are planned and unplanned C-sections, and a planned C-section just means that at some point prior to going into labor, the plan shifted, and now the plan is a cesarean. This could be for breech, this could be for a certain medical condition going on, an abnormality with baby, whatever it is. So for a planned C-section, a doula can help with things like preparation, helping understand the process, setting expectations, helping you know questions to ask your provider prior to the day of, and helping you create a sense of control and also a postpartum plan potentially for after the baby is born for the things that are going to shift potentially. And then an unplanned C-section is where at some point in the labor process, the plan pivots. And that pivot takes processing. There are emergency cesareans and non-emergent cesareans. I think that a lot of people that have C-sections think they had an emergency C-section, but actually a lot of them are non-emergent. If it took a while to go back into the OR after the decision was made that a cesarean was needed, it was non-urgent. It doesn't mean that it wasn't necessary. It just means it was non-urgent. Emergent cesareans are where we are rushing back to the OR. So in each of those situations, a doula's role is a little bit different. If it's a cut and run, like we've got to hurry up and go, there's not as much talking that we can do, but we can help with processing the pivot, helping with emotional grounding, and also helping prevent trauma or overwhelm, and also the support in both of these situations for the partner, not just for the person who is receiving the cesarean. So this emotional piece really becomes even more critical when the plans change because it can be like a hard pill to swallow, a really emotional decision or shift in your plan. It's also really important to know that some hospitals do allow doulas in the OR regularly. There's a hospital in Austin here that I know, unless someone's going under general anesthesia, that I'm going to be allowed in the OR. And even if the person goes under general anesthesia, even the partner isn't allowed to come into the OR in that situation. There are also hospitals that allow them on a case-by-case basis. Oftentimes when that's the case, it is because of anesthesia. Anesthesia will often make the call. There are nurses and OBs that will really try to, advocate for the doula to come into the room, but that isn't always successful. It's also sometimes because some of the OR rooms are much smaller than the other OR rooms, so that can also be a determining factor. And then there are some hospitals that absolutely never allow doulas into the OR. There are a couple of here in the Austin area. I just know 100% they're never going to let us in. I've never heard of any doula being let in, and that's just how they do things. The PACU, which stands for Post-Anesthesia Care Unit, is the recovery area after a cesarean. And when people go to that, it's usually about 2 hours that they're in there before they go back to a regular room. So in the PACU, some hospitals will allow doulas into the PACU even if they weren't allowed into the OR. Some don't allow doulas in no matter what. But there are things that we can help with in all of these situations. So there's really no universal policy, and you really need to ask your provider and hospital ahead of time what their rules are. This may change whether or not you want to give birth at a certain place. And actually, if that happens enough, maybe they will start letting doulas into the OR more frequently or as a standard if parents are the ones to speak up. Unfortunately, if we're the ones speaking up as doulas, it really nothing's going to get done. But if parents are the ones that are speaking up and saying, we want our doula to be allowed into the OR no matter what, as long as it's not general anesthesia, maybe we might start to see a little bit of change there. So the typical flow of a cesarean, usually it's that first the birthing person goes back into the OR before the partner. Generally, they don't let the partner or doula into the OR before certain things happen. So when they get rolled back into the OR, it's the doula and the partner that are left in either the like a waiting area in the hall or even maybe still in the room that we started off in. For a planned cesarean, that might be the triage room. If we were already in labor and going into the OR, then that might be the laboring room. Anesthesia will then either epidural, like have a bolus of the epidural, so make it denser so that it covers more, so that the C-section can be performed with the epidural if one was already placed. If an epidural hasn't already been placed in labor, then usually they use a spinal. Then they will, once you're numb, they'll give a catheter so that you don't have to urinate and your bladder is empty. And then they will do a sterile draping and prep. So they get the area all clean. They have all of these drapes up and have that sterile area so that nothing is going to cause infection. And then the partner, and if the doula is allowed to, are coming into the OR. So this is really a vulnerable time for a lot of people. Being alone in the OR without the partner can be really upsetting for the person that just got wheeled into the OR. And then the partner waiting in the hallway or the other room can be really a heavy feeling. So even if the doula is not allowed in the OR, it's possible that they'll be able to stay with the partner in that waiting area. We can help answer questions in this moment for the partner, help interpret what's happening, help them know what to expect when they go into the OR, and keep them calm and grounded, and just help them know how to show up better for mom in the OR, whether the doula is being able to be present or not. Some of the things that we can help with if we are in the OR when we go back are communication. So I can help help explain what's happening in real time, and also help translate some of the medical language into understandable things. They're not always explaining what they're doing, but if I hear something and I'm able to kind of translate what that means so that parents understand the process, that can be really nice, especially because sometimes they'll say something that sounds really scary on the other side of that drape. And the parents will look at me like, what does that mean? And I'm like, oh, that's really super normal, X, Y, and Z. Or they hear a bunch of beeping machines and they're worried that that means something's wrong. And I can help interpret what that means or even ask the anesthesiologist, if they can explain it, and help people feel more oriented and not as overwhelmed. So all of that communication support is really important in those moments. Emotionally, I can help with grounding, reassurance, processing if you're struggling and having a hard time with what's going on in the moment, and helping regulate anxiety. And then for physical comfort, support with nausea. Sometimes I even bring a little bit of like peppermint oil or something in a little baggie into the OR for smell help when you're nauseous. Lemon oil can also be helpful with that. But then sometimes it's just that the anesthesiologist doesn't hear that you say you're really nauseous. So when someone is lying down and in that position and numb from the waist down, you don't really speak up as much. And also things can be a little bit loud in that area. So the anesthesiologist may not hear that you're saying, I feel nauseous or I feel dizzy or anything like that. And I may be speaking up for you and saying, hey, she's saying that she feels X, Y, and Z. And then they can help adjust medications and things like that to help. Also helping you with your hands being comfortable or your hair's in your face, little things like that. Whereas a partner can help with that too, but they are less likely to speak up in those moments because they're also in a really vulnerable position at that time. And then things like baby moments. So helping facilitate skin to skin, if that's something that they do in the OR, they are helping advocate for some of your preferences. Maybe if they take baby over to the warmer, but you really wanted skin to skin with the baby before they do weight length footprints. And I see that they're over there doing weight length, about to start doing that. I can say, hey, she really wanted skin to skin before any of that. Is it okay if she gets skin to skin now? Or are we at a point where the baby's stable enough to do that? So there are things that I can ask questions for. And Again, a partner could do that, but will they know when to speak up? Likely not, because again, very emotional time for them as well. And they are showing up in their best way at that time too. If the partner wants to go over to the warmer to see the baby, they can do that. And then I would stay with the mom. The doula stays with the mom. Or if the partner wants to stay with the mom and wants me to go over and take pictures of the baby when they're doing whatever they're doing over there, and then bringing pictures back for mom to be able to look. Also, if the baby goes to the NICU, partners are allowed to join that baby in the NICU. So the doula might stay with the mom so that she's not alone. I mean, I say alone. Yes, there are still nurses and anesthesia and things like that in there, but not that one person that mom knows in that moment. So we want to make sure that no one feels alone during those most important moments. So in the OR, I'm doing things like helping support bonding, helping you guys stay calm, mom stay calm during stitching and closing. Oftentimes the baby comes out pretty quickly after they're born, but goodness gracious, it can feel like it takes forever for stitching and closing. And I can help with some of that communication back and forth and understanding where we are in the process. And then we roll over to the PACU, the post-anesthesia care unit. This is where recovery happens. Generally, people are there for about 2 hours. It can help with comforting positions. It can be a little bit wonky because you have, something connected to your finger and leads on that they're checking your heart rate and things like that. And breastfeeding can be a little bit more difficult. So if you wanted to breastfeed, then I can help facilitate that. Doulas can help facilitate that. But also, if you're just struggling with even having the energy to do so, sometimes some of the medications that they give in different situations can cause a lot of drowsiness. Not always, but some of those medications can. It's also a good thing that I help do in the OR is ask before they're giving medication to the mom, what are you giving her and what are the side effects that may have so that she can prepare herself. And if they say if they say it can cause drowsiness, I might be asking, okay, is there another medication that can be used instead? Because she really wants to breastfeed after this and to have the energy to do so. And sometimes they'll be like, oh yeah, we could switch it to whatever. So breastfeeding, I've even had moms that are like, Sierra, I just feel like I can't do it. I feel like I can't breastfeed right now. And I'll say like, do you want me to do it for you? I'm not going to breastfeed their baby, but I'm going to help them place their baby to their chest. I'm going to help the baby stay in that position to be able to nurse if the mom's unable to do so. And then really normalizing what's happening physically and emotionally, and even starting to process sometimes. Sometimes people already are starting to chat about what's going on and what just happened. And support there is huge for partners and for the person that just had the C-section. So it is a really common myth that people think you don't need a doula for a C-section. And sometimes providers might even say this. A couple of weeks ago within my company, one of my doulas showed up to a C-section. It was a surprise C-section. We found out the day before that the baby was breech, and they were going to maybe go do an ECV or something like that. But the next day her water's released. So surprise, we're having a baby today. And when she got there, she was in the waiting room and waiting, for the parents. And they were like, you know what? Our doctor actually said that there's really not anything that you can do back here. So we don't need you to stay. You can go ahead and go home. Well, that's a hospital that doesn't let doulas ever come into the OR. And so they're just saying like, the doctor's like, oh, we got you. We can help you out. But the nursing staff is busy, and she could have stayed, even if they didn't let her in the OR, she could have stayed and gone into the PACU and helped with things like recovery, breastfeeding, those sorts of things, answering questions, processing. But they had already decided that they didn't want her to stay because their doctor told them that, she doesn't need to. So this is just not accurate. I think it's really important to ask questions, advocate for yourself, but ask your doula what they think if you're being told that, have that conversation with them, that this is what you're being told, and ask them how they help in a C-section or in recovery. I'm telling you right now how I do it, how I train doulas to do it, how the doulas on my team do it, but that doesn't mean that that will be your doula's experience or plan. So if anything, a C-section birth increases the need for continuous emotional and informational support. It does not make it so that you don't need a doula. And most doulas don't offer refunds. So if you choose to not have them present in the OR or the PACU, the provider won't allow them in, or the hospital won't allow them in, that usually does not qualify you for a refund because they were still on call. They were still providing all of the prenatal appointment or prenatal meetings and prenatal check-ins. And if you already were in labor, they did all of the labor support leading up to the C-section, or helped prepare you in conversation for the C-section. So it doesn't, we can still have a place. We can still do things in that situation to help. It doesn't mean that you should get a refund, though, unfortunately. So you're not just hiring a doula for a moment, you're hiring them for the entire experience. However your baby enters the world, you deserve to feel supported and informed and not alone. So ask your hospital about the policies before you decide to give birth there. Interview doulas and ask about their C-section experience, or at least C-section training. You don't have to have have experience in the OR to be able to be a good doula in a C-section. I train about this in my birth doula training to the birth doulas that take my program, and they are fully able to help in that experience because they've been really well trained. And reach out to me, reach out to anyone who is a doula. Ask us for help. If you have questions, we want to answer them. A C-section birth is still a birth, and you deserve help every step of the way. So I hope this was helpful. I hope that you now feel like you understand a little bit more about how doulas can give support in the OR. And I hope you have a great day. Let me know if you have a topic that you want to hear about. I would love to hear it. Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.